It's interesting that some patients come with knee pain, but they can have problem in the hip. How do we figure this out? It's very important to have a proper consult where I spend some time in understanding the pain, the type of pain, how it is aggravated, how the pain is relieved, what are the factors which are making the pain worse. Do they have any rest pain or night pain? So there are several things we need to talk with the patient. What activities are bringing on the pain? Is the patient able to sit and rise easily, or is there any difficulty in doing that? Can they squat down on the floor, or they have difficulty? How is their chair climbing capability? So when we think about all this, that will give us an idea whether the pain is coming from the knee or from the hip. And once we are done with the initial history taking, then we start examination. In the examination, I see how he is walking. Is there any deformity in the knee? Is there any swelling in the joint? How is his hip movement when he is walking? And then we do a test called Trendelenburg test to see how the balance is of his hip. And once that is done, we look at the movements of the joints. We look at the movements of the hip and movements of the knee. And if there's any limb length discrepancy. All this put together along with investigations like X-ray and MRI, then we can come to a conclusion whether the pain is coming from the hip or it is from the knee itself. Yes, patients will have hip avascular necrosis or arthritis in the hip, which is affecting the inner aspect of the wall, which can cause referred pain in the knee. So not all knee pains are from the knee itself. There are some knee pains, particularly on the inner side of the knee, which can be referred from the hip. So it is very important to go through that proper clinical examination and then getting the right investigations done to know the cause of the pain.